Gastric ulcers, also known as stomach ulcers, are painful sores that develop on the inner lining of the stomach. These ulcers occur when the protective layer of mucus in the stomach becomes too thin or gets damaged. Without enough mucus, the stomach lining is exposed to stomach acids, leading to irritation and ulcer formation. So, what exactly causes these painful ulcers, and why do they happen? What are gastric ulcers? Gastric ulcers are a type of peptic ulcer disease, which also includes duodenal ulcers that form in the upper part of the small intestine. These ulcers appear as small, round, or oval sores in the stomach lining and can cause a range of symptoms, including a burning sensation in the abdomen, nausea, and even vomiting. They vary in size, from small, barely noticeable sores to larger, more painful ones. Causes of gastric ulcers. Helicobacter pylori. One of the most common causes of gastric ulcers is an infection with a type of bacteria called Helicobacter pylori, or H. pylori. This bacterium can damage the protective mucus layer, making the stomach lining more vulnerable to the corrosive effects of stomach acid. H. pylori infections are widespread, but not everyone infected will develop ulcers. Causes of gastric ulcers. NSAIDs. Another significant cause of gastric ulcers is the prolonged use of nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen, and naproxen. These medications can weaken the stomach lining by inhibiting the production of protective mucus. People who use NSAIDs regularly, especially at high doses, are at an increased risk of developing ulcers. Causes of gastric ulcers. Stress and lifestyle factors. While stress and lifestyle factors alone do not directly cause gastric ulcers, they can exacerbate the condition or make symptoms worse. High levels of stress, smoking, and excessive alcohol consumption can contribute to an imbalance between stomach acid and mucus production, increasing the risk of ulcers. A diet high in spicy foods and caffeine may also irritate an already sensitive stomach. Symptoms of gastric ulcers. The most common symptom of a gastric ulcer is a burning pain in the middle of the abdomen, usually between meals or at night. Other symptoms can include bloating, heartburn, indigestion, and in severe cases, vomiting blood or passing black, tarry stools. If you experience any of these symptoms, it's important to seek medical attention, as untreated ulcers can lead to serious complications. Diagnosis and treatment. To diagnose a gastric ulcer, a doctor may recommend tests such as an endoscopy, where a camera is used to examine the stomach lining, or tests for H. pylori infection. Treatment typically involves medications to reduce stomach acid and, if necessary, antibiotics to eradicate H. pylori. Lifestyle changes, like avoiding NSAIDs and quitting smoking, are also crucial for healing and preventing future ulcers. Complications of gastric ulcers. If left untreated, gastric ulcers can lead to serious complications. These include bleeding, where an ulcer erodes a blood vessel, causing significant blood loss. Another complication is perforation, where the ulcer creates a hole in the stomach wall, leading to a severe infection in the abdominal cavity. Gastric outlet obstruction, where the ulcer blocks food from leaving the stomach, is another possible complication. Prevention of gastric ulcers. Preventing gastric ulcers involves maintaining a healthy lifestyle and being mindful of medications. Avoiding the overuse of NSAIDs, reducing alcohol and caffeine intake, quitting smoking, and managing stress can all help protect your stomach lining. If you need to take NSAIDs, consider using them with food or asking your doctor about alternatives. Myths and misconceptions. There are many myths surrounding gastric ulcers, such as the belief that they are solely caused by spicy food or stress. While these factors can aggravate existing ulcers, they are not the primary causes. Understanding the true causes, like H. pylori infection and NSAID use, is essential for effective prevention and treatment. Gastric ulcers are a common but manageable condition. Understanding what they are, why they happen, and how to treat them can help you take control of your health. If you experience symptoms or are at risk, consult your healthcare provider for guidance. Early diagnosis and proper management are key to preventing complications and ensuring a healthy stomach. If you found this information helpful, don't forget to like and subscribe for more health-related content.